This is a 46-year-old male who comes with blurry vision. George Smith, blurry vision is a case. Vitals are stable. Yep. Yeah, come in.
Hey, Mr. Smith. My name is Dr. Deol. I'm taking your history of physical injury. What brings you in?
Doc, I cannot. This eye, I cannot really see. It's like more blurry.
You can't see out of your right eye? Okay. Let me just write that down. Give me a second. When did this start?
Oh, like, no.
First of all, I'm sorry it's happening to you. I know it's very scary that one eye is not working properly, but we'll get to the bottom of it. Okay. Please, continue.
2 days ago when I was driving, I suddenly saw, I was seeing double. And since then, the eyes have been blurry.
So double 2 days ago and blurry. Okay. Are you feeling any pain in your eye?
No.
Have you noticed any swelling?
No.
Any watering of the eyes?
No.
Any color changes?
No.
What were you doing 2 days ago when it started?
I was driving now.
You were driving. Okay. And it happened all of a sudden?
No, not all of a sudden. It just happened gradually. I'm so scared of this blurry vision, doctor.
Has it ever happened to you before?
No.
It's the first time. Okay. Don't worry, we'll find out what's going on and put you back on track. How does that sound?
So, if you say this word, I said I'm so scared. Just lift your arm and put in, don't worry. We are here to help you out. Let me get to the bottom of it and then please bear with me. Let me get at this history. A small little change of getting up and showing enthusiasm.
Okay. I should get up off my chair.
Just showing a little more concern. Okay. Get off the chair to get a tissue if patient is crying. Get, touch the patient and say, hey, don't worry. This is a safe zone.
Right.
That little bit oomph is important.
Do you notice anything associated with your eye, blurry vision in your eye?
I've noticed that it's double vision and,
And
I feel a little numbness and tingling in the hands.
feel numbness and tingling in your hands. Did that also start at around the same time?
Yeah, I saw, the things have been dropping from my hand.
Okay.
I'm so scared.
You'll be okay. Have you noticed anything that helps make it better?
No, nothing.
Are you taking any medication
No.
for these issues?
No.
If you allow me a second to just collect my thoughts. Mr. Smith, do you feel tired?
Yes, I do feel fatigued.
Feel tired?
Mm-hmm.
How long has that been going on?
About 6 months.
6 months. Has it limited what you can do during the day?
Yeah.
Do you have trouble sleeping at night?
Not exactly.
Do you have any previous medical history in terms of diseases or ongoing issues?
No.
Do you have any allergies?
No.
Are you taking any medications at this time?
No.
Have you had any surgeries in the past?
Oh, just look, there was a gland over here, you know, this nodule in the thyroid gland. That was it.
On a nodule?
Yeah.
What they do to it?
Just they did the biopsy of it, and everything was negative after.
Okay, when was that?
About 2 years ago.
Any complications from the biopsy?
No. I had a very good doctor. I hope you're also a very good doctor.
I try to be the best I can be, so I hope you value my history as well. Mr. Smith, do you have any diseases that run through the family?
Just the blood pressure.
Just blood pressure?
Yeah.
Okay. Any diabetes? Any heart problems?
So are you asking me about diabetes or are you asking about heart problems?
Or any diabetes that runs through the family?
What is diabetes, doctor?
Diabetes is when the blood sugar is high.
Oh yeah, yeah. No blood sugar.
Okay. Any heart attacks?
No.
Any stroke?
No.
I'm going to ask some questions about your lifestyle, Mr. Smith. Do you drink any form of alcohol?
Just barely on social occasions.
Okay. Do you take tobacco in any form?
Not exactly.
Not exactly. Is that a no or a maybe?
Oh, you know, once in a blue moon cigar and I'm playing golf. That's it.
Okay.
That's not. I don't inhale. I don't inhale anything.
Okay.
I don't inhale. It just goes out.
Well, I wouldn't be doing my job if I let you know that also by not inhaling, the cigar smoke that stays in the mouth can lead to dental problems, gum problems, and even more serious things. So I'd advise you to
Like what, doctor?
smoking cigars long enough can cause oral pharyngeal cancers as well.
I thought Dr. Google told me that cigar increases the bladder cancer. How does it cause oropharyngeal cancer, doctor?
So
What is oropharyngeal? So you're
Sorry.
using such a complicated words, doctor.
Yes, okay.
I don't know.
All right, to better explain it, I can draw a picture for you. When you take in cigar smoke, okay. Basically, it's the mouth. The mouth and the throat area is what we're concerned about. Okay.
But I don't inhale.
I know. So when the smoke, you take it in the mouth, correct? So the smoke is in this area. In this area, you have your teeth, you have your tongue, you have the lining of the mouth, right? You have these soft tissues back here in the throat that could also come in contact with the smoke, and therefore they can cause cellular changes.
Okay.
Yeah. So I'd advise you to also stop doing that. Okay. Do you take recreational drugs in any form?
Just marijuana.
Okay. How often?
Just started 2 months ago. Every once or twice a day.
Oh, that's interesting. Why did you start?
Because it was just made legal in Michigan.
Okay. Just okay.
But okay.
I'm acknowledging that you're taking marijuana since 2 months. That's all I'm saying.
Yeah.
Okay. Have you ever been hospitalized in the past?
Not exactly, doctor.
Not exactly. Okay. So what does that mean?
I've not been hospitalized.
Okay. I'll take your word for it. Have you had any difficulty going to the bathroom?
No.
Have you traveled anywhere recently?
No.
Okay. I will ask some personal questions. They will be confidential. Are you sexually active?
In the last 2 years, I've not been sexually active
Okay.
because of sexual dysfunction.
Really?
Mm-hmm.
Can you describe it to me?
I can start the intercourse,
Okay.
and but during the intercourse, it becomes limp. I cannot maintain and cannot complete. I don't know why.
Okay. Okay. How's this patient's weight and BP? Okay.
Yes, everything's fine.
Everything's fine. Okay. Have you noticed that your appetite has changed at all?
It's been a little less.
You've been eating less?
Yeah.
Okay. Do you find yourself frequenting the bathroom more often?
Yeah.
You already do? Do you find yourself drinking more water?
No.
No. Alright, so to me, it seems like you are having double vision in your eye that you've been blurry.
That I already told you.
Right, I'm just kind of reiterating that. So,
So you told me this.
right, so you told me that you've had blurry vision for the last 2 days in your right eye, that you're seeing double vision, that it happened gradually, and not all of a sudden. And then you've also been having some numbness and tingling in your hands, and you've been dropping items. Okay.
And what?
And that you've had decreased appetite, you've had problems maintaining intercourse. Okay. Which of these concerns bothers you the most?
Everything.
Everything. We'll address all these things today. Don't worry. You better take a look into your eyes and see if there's any issues going on there. Before I do that, I will drape you with this gown. There you go. Right, before I begin, could you please take off your glasses? Thank you. I want to make sure you're not feeling any pain around your eyes, so please tell me if you do. Anything? Okay. Could you please look at a distant object? And once more. Thank you. Now, I will look into your intercourse problems and schedule an appointment for that. Alright, to me, Mr. Smith, this is what I've assimilated so far. Okay, that you could be having some sudden issue going on with your right eye. Okay, and I want to run some tests in order to find out exactly what it could be. To me, I would like to order a blood sugar test on you. I would like to follow up with an eye doctor. Okay. And your next visit, I would also take a look into your intercourse problems. And that's all I have.
And if your symptoms worsen, follow up with me. Activity, weight, worries, medications, driving. Doctor saw empty. Would you allow me to drive?
I would not allow you to drive.
Why did you not say? Counseling. Remember general counseling? Case-based counseling. case based. You don't know what's going on with this patient,
I don't.
right?
Yeah.
So, but you never examined me. I have a neuro examination has to be done,
Yes.
right?
I panicked.
So,
I saw the time. I was like, okay, I just need to jump into it.
so neuro examination was important.
Yes.
Eye examination was important.
Yeah.
Carotid examination was important.
That's fine.
Carotid, because I'm blurring of vision. What if there's a clot?
Yes.
What are the features of multiple sclerosis?
So,
Numbness and tingling, things falling from the hand, blurring of vision, double vision, sexual intercourse which you cannot maintain because of nerves. So, Lermet sign, you have numbness and tingling, passing, lightning sensation over
okay.
here. Urine incontinence will happen, but it will may happen late.
Okay. That's,
So,
to my mind, that's one of the things
so what I can tell you from this is collecting all the data and assimilating it. You know the things, but you are not able to assimilate the
what it
things.
means. Yeah.
So in my book, ProToUSMLE book, on the back side, there's a differential diagnosis, list of differential diagnosis.
Okay.
So that will really help you if you can cram those things. That will help you to open up.
All right. I have no idea what's going on in this patient.
Yes, I knew that.
Okay.
The reason I'm going to increase the toughness of the cases, because when you get an easy case, it will be very easy for you.
Okay.
But again, our main goal is improvement, continuous improvement.
Okay.
Thank you for watching the video. Enroll now in our Lean Patient Experience Certification course, link in the description below.